Hi everyone, welcome back to another discussion on a kids' health topic, which is the theme of this week. And I'm going to jump straight into this topic, which is a very common topic, also seen in clinical practice, but you are bound to know somebody either within your family or extended family and friends that has an allergy. So today I'm going to be talking about allergies in children, which does transfer over to adults as well. And looking at some of the different types of allergies, some of the signs and symptoms, what you can actually do about it, and when you should seek some help. Because there is lots of effective things, particularly for the long term, that you can do to help with symptoms of allergy, but also kind of prevention as well. So if I just start off with statistics. So if we look at, for example, food allergies in children, it's about 1 in 20 these days, which has definitely increased, and that is only food allergies. So that's not taking into account asthma, eczema, and some of those other allergies that are really common, particularly in children. And if we look at the different types of allergies, specifically what I am referring to there is about the immune responses. So we can get different types of immune responses, which transfers to the different types of reactions that somebody might have if they're reactive or having an allergy, do have an allergy to a particular food or toxin. So we have different immune reactions. So we have an IgG response, we can have an IgE response. So the IgE is can be the more serious, so the anaphylaxis, definitely, particularly to different foods, but also to environmental toxins as well. And there are some other different arms of the immune system that have reactions as well. So if I just quickly talk about the different signs and symptoms that may indicate your child could have an allergy. So if we look at sneezing, runny noses, particularly if you notice sneezing or runny nose only at a certain time of day or only when the child's exposed or in a certain room or environment. We can also look at kind of those other physical signs and symptoms, so hives, eczema, which is really common as well, the eczema dermatitis presentation, so the itchy skin, particularly in certain patches, so you might get it in the kind of the creases, so the elbows, behind the knees, but you can also get it all over the body, and particularly in little babies, you can see it on the torso and the face as well. Congestion, so I did mention sneezing and runny noses, but congestion is another form or could be another sign of an allergy. And also allergies can present with digestive symptoms. So in the little ones, looking at reflux, particularly in the first year of life, but ongoing from there, so anything from constipation, tummy pains, diarrhea. So any of those symptoms can indicate an allergy or a food intolerance in a little child as well. And I guess not forgetting the more serious reactions that people can have. So the anaphylaxis, so that's where this affects actually the airways, and people can swell and stop breathing essentially. So that's the more serious one. And if that is a reaction that you have seen before, you would most likely be under the care of an allergist or an immunologist, which is definitely recommended, just to see exactly what those reactions are happening to, if you can ascertain that. So looking at what you can actually do, because there's lots that you can do, particularly when we're looking at natural medicine. And when I refer to natural medicine, I'm referring to kind of nutrients, herbs, and then really targeting on some gut health supplements as well. So I think the first thing you need to do is you need to try, if you can, find the cause. So what is the allergic reaction happening to? So is it a food? So if we look at foods, the top 8 allergens that people are most likely to react to include peanuts, tree nuts, sesame, fish, wheat, soy, and what have I forgotten there? Shellfish, eggs, and one of the most common ones actually is dairy. So not only can dairy kind of just be an intolerance for someone, but it can actually cause quite a severe reaction in some people as well. And when you're looking at kind of digestive symptoms, any of these ones, but particularly some of the dairy and eggs and wheat, can be one of the kind of go-tos when we're looking at finding the cause and eliminating to assess if that is actually causing or is a factor in that reaction. So once you kind of identify the cause, another thing that you can do is to actually reduce the load or the toxic burden for that person. So just as I mentioned about food elimination then, if dairy is, for example, one of those foods that your child's reacting to, elimination, so reducing that load on the body, because when we look at allergy, essentially it's a chronic inflammation of the body. So all of those cells that come in and play a role in causing that allergic response, it's actually a natural process in the body. It's just kind of like an abnormal immune response. So reducing the load, so whether it be a food and we eliminate, if you do find out that kind of that constant blocked nose and sneezing first thing in the morning is a reaction to dust mites, so taking precautions around reducing that load, particularly at bedtime for the child. So making sure you wash sheets properly. If it's a high pollen day and they do react to pollens such as hay fever, don't hang the sheets on the line, dry them inside. Making sure you use a hot wash, and also making sure there's a good airflow in the room as well, and vacuuming, floorboards, all of those kind of precautions that you can do to reduce the load for somebody. Another thing that you can do is start to look at supporting the body and the immune response. So looking at key nutrients that are required for a good, robust immune system and gut health. So if I start with nutrients for immune health, so zinc is a really important one, and that crosses over into a lot of different systems and to gut health as well. Vitamin A is really important when we're looking at immunity. Vitamin D, which I've mentioned in a couple of the talks already, but vitamin D is super important. And if you do see a naturopath or a health practitioner and you have managed to have blood tests done for your child, and particularly vitamin D, it's a really good idea to have a look at the levels, because optimal levels can be much higher than, well, it's really rare actually to see somebody at an optimal level to be within the range, for example. So if you're at the low end of the range, boosting it up to an optimal level is definitely going to be a priority. And I'm talking about vitamin D. Some other nutrients are vitamin C, the essential fatty acids, so the omega-3s found in fish oil. That's really, really good, particularly for inflammation, but also for skin health. So if we're looking at eczema, that's one of the good supplements that you can include to help with that. If I touch a little bit more on gut health, which I have in every session because it is such an important aspect of our health. And as I have mentioned before, gut health does kind of regulate our immune system. And when we're looking at improving gut health, there's a few key things that we need to remember. So the first thing is looking at the gut barrier function. So making sure that the cells that line our digestive tract are intact, so that things that shouldn't be able to transfer into our circulation through a leaky gut, or through the cells being a bit more permeable than normal, making sure that toxins and those other kind of bacteria and larger proteins can't get through into our circulation, because that is part of that abnormal immune response. So our immune system begins to react to things that it really shouldn't react to. So when we're looking at gut health, so some of those key nutrients I've already talked about. So zinc, vitamin A, vitamin D, really, really important for gut health. And then probiotics. So what we know with probiotics, that specific strains do, or they perform different functions in the gut. So you can get strains that are really good and work in a variety of different ways to help with that gut barrier permeability, so keeping those cells together. And also some certain strains of probiotics can help to break down toxins that are produced by bacteria, because we all know about the delicate balance of our microbiome and how it can easily kind of be thrown out of balance through medications, antibiotic use, stress, and there's loads of other ways it can be thrown off balance. But the ease of that and looking at how we can kind of combat that with specific strained probiotics. And the other one is prebiotics. So I have talked about this also, but prebiotics essentially are the food for these good bacteria, so it's encouraging their growth. And bacteria, particularly the good bacteria that are well researched now, we know they perform certain beneficial functions within our gut. So it's important to have those in high numbers. If you are concerned with this, there are really good stool testing or stool analysis that is available now to assess kind of that balance, so to see exactly what's happening in the gut. And as well as improving gut barrier function through those mechanisms I just talked about, the probiotics, the prebiotics, the nutrients, also looking at the barrier function of our nasal passage, for example. So that's really important. So someone that has had that chronic congestion, the chronic rhinitis, so looking at managing that and looking at the microbiome of that, which is really quite interesting. And ways that you can manage that is through nasal sprays, saline nasal sprays. That's really good, particularly if somebody does experience that congestion or reaction to certain pollens or environmental toxins as well. And the other barrier that is important to look after and keep in integrity is our skin. So that's because eczema and dermatitis, as I mentioned before, is really common. So looking at certain key nutrients that we can take orally, but actually apply orally as well to help with skin health. So once again, zinc comes up, vitamin A, your essential fatty acids definitely, and there's lots of great creams out there, natural-based creams, some with some added herbs in there to help with that skin barrier function. So they're really good for, particularly for that symptomatic relief, but knowing that when you apply that cream, it's actually quite nutrient dense and helping that skin and the skin barrier as well. Because essentially that's probably it's one of the main jobs our skin does for us, to keep it intact, and it's very protective for us. It's the first point of contact. So just to finish off, when to seek advice. So of course, if your child has had an anaphylactic reaction or even mild swelling, particularly if you're looking at the oral cavity, I definitely recommend to go straight to your doctor to get a referral to a specialist if indicated. But another time when it could be important for you to seek advice from a health professional, whether it be a naturopath or an allied or complementary therapist, is if the allergy or the reaction that your child is having, you can't ascertain what it is, so you don't know what's actually happening. If it's of a chronic nature, so it's starting to happen more frequently or it's kind of underlying most of the time, there's some of the times I'd definitely recommend to see a practitioner, because just touching on some of these ways that some of the nutrients and some of the other kind of ways to identify what's going on can really help to reduce those symptoms, and particularly for the long-term health of the child as well. So I hope you all have a great day. I hope you've got a little bit out of this. It is quite brief, but I guess it's just to bring to your awareness some of the common allergies, what you can actually do, and some of those key ways, including nutrients, herbs, and looking at gut health, to help with some of those symptoms in treatment. So just remember, if you have any questions, please get in contact via email. And you can also jump onto my website and have a look. And if you did want to have a private discussion about the next steps to help your child, particularly if they are having that, they've got that chronic kind of nature happening with their allergy, please get in touch because I'd love to have that conversation with you. Have a great day, and I look forward to chatting again very soon. Bye-bye.